milliliter volume. You will need the following materials for this Tropus educational video: PharmaJet Tropus injector, filling adapter, needle-free syringes, rubber ball, vial of non-sterile saline for injection into the ball. When you're done with this video, you should be able to properly prepare the injector, accurately fill the syringe, properly load the injector with the filled syringe, successfully administer the injection to the patient, and dispose of the used syringe. Step 1. Prepare the injector. The first step in using the PharmaJet Tropus injector is to prepare it for use. The injector should be in the open and uncharged state. This can be verified by observing that the injector hammer is visible. Squeeze the injector handles until they close and are locked in place. Once the injector handles are closed, ensure the injector pin is recessed, indicating the injector is charged. If the handles are closed and the injector is uncharged, simply depress the green rear injector latch button to allow the injector handles to open fully to prepare for charging. Step 2. Fill the syringe. Remove the protective cap from the vial packaging and prepare the top following aseptic techniques. To transfer the solution from the vial into the needle-free syringe, remove the green protective cap from the syringe. Attach the needle-free syringe to the filling adapter by pushing the end of the syringe down into the top of the filling adapter and twisting clockwise to lock it in place. Next, remove the protective sleeve from the spike of the filling adapter. Being careful not to touch the spike, align it into the center of the vial rubber stopper. Next, with a downward twisting motion, insert the filling adapter into the vial until it is fully seated. Ensure the holes in the filling adapter spike are below the vial stopper. Use standard procedures for pressurizing the vial prior to drawing the fluid if necessary. Do not attempt to use a partially filled syringe. Invert the assembly and pull down on the syringe plunger to draw fluid into the syringe, removing air bubbles as required. Draw down the plunger to the point where the red O-ring is slightly beyond the fill line. The 0.1 milliliter fill volume is automatically set when the syringe is inserted into the injector, so a slight overfill at this step is preferable. While keeping the entire assembly inverted in your hand, snap off the end of the plunger at the neck with a bending, not twisting motion, and discard. Step 3. Load the injector. Pick up the charged injector and insert the syringe and vial assembly into the injector until you hear a click, locking it into place. Any overfill in the syringe is purged back into the vial during this step. Reinvert the assembly and remove the filling adapter and vial from the syringe using a counterclockwise turn. Step 4. Give the injection. Practice. Before injecting patients, please practice utilizing the rubber ball provided with your practice kit. Depress and hold the yellow injector safety button with your forefinger. This allows the inner core housing to retract freely. While holding the safety button, press the syringe perpendicular to the rubber ball at a 90-degree angle, with enough gentle pressure to retract the inner core housing. Once the inner core housing is retracted, it is not necessary to hold the safety button, as long as you keep pressure on the ball and it remains retracted. It is important to only apply enough pressure to retract the inner core housing. To inject, depress the activation button with your thumb. A click will be heard upon injection. Verify that the syringe contents were delivered by observing that the plunger has advanced completely to the syringe tip. Removal of the syringe from the injector is accomplished by pressing inward on the ejection button under the injector. Dispose of the used syringe per standard procedures. It is not necessary to recap the needle-free syringe prior to disposal. Before injecting a patient, this process should be repeated until you feel confident. Patient injection. Patient assessment and preparing the injection site location should be performed per Centers for Disease Control guidance. Prior to the injection, it is suggested to say to the patient, "Listen for the click." Once you hear the click, the injection is complete. Needle-free injection sites are identical to those used for conventional needle and syringe. The deltoid, suprascapular, and lateral thigh areas are most often used as the delivery sites for vaccine. Other types of injectant may have specific sites for injection. Follow package directions from the manufacturer of injectant. It is important to note that you only need to apply enough pressure against the patient as required to retract the inner core housing. To give an injection, depress and hold the yellow injector safety button. This allows the inner core housing to retract freely. While holding the safety button, press the syringe perpendicular to the injection site. Once the inner core housing is retracted, it is not necessary to hold the safety button, as long as you keep pressure on the patient at a 90-degree angle and the inner core housing remains retracted. To inject, depress the activation button with your thumb. A click will be heard upon injection. Verify syringe contents were delivered by observing that the plunger has advanced completely to the syringe tip. Immediately apply pressure with cotton or gauze for 60 seconds, and then apply an adhesive bandage. Removal of the syringe from the injector is accomplished by pressing the eject button under the injector. Dispose of the used syringe per standard procedures. It is not necessary to recap the needle-free syringe prior to disposal. Once the syringe is ejected, press the rear injector latch button to allow the injector handles to open freely. Ensure the hammer is in the uncharged position.